Okay, fantastic. So you guys got it. All right. So today, week 6, let's see. Oh, still getting people in. Um, so today we're going to do the quiz. We'll review the quiz. And then we'll go over whatever content that we don't cover in the quiz with environmental health, occupational health, and barriers to learning. And then we'll break up in our breakout rooms and do our case study. And then we'll come back and talk about the case study. Okay. After this class, I'm doing my exam 2 review at the top of the hour. Okay, so if anybody can stay on, fantastic. I'll send you a recording this evening of the exam review. Okay, you guys will be testing a week from today. All right. I've already sent you Professor Ford's review a couple of days ago. So you have that. You'll have mine tonight, and you'll have a third opportunity for a live review on Sunday evening with Professor Kershaw. I think Sunday evening at 6 o'clock Eastern. Okay. And then I'll send you, you'll get that recording Sunday night or Monday morning. All right. So you have you have three recordings. But if anybody can stay on after class, that'd be fantastic. We could do a review. What else did I want to mention?
So if we can't stay on after, we can listen to the recording.
Yeah, absolutely. And I would encourage you to listen to the recording, please. We didn't have any attendance on Tuesdays, so hopefully we're going to get some better attendance for the next 2. What was I going to mention? There was one thing I was going to mention. What was it? Oh, this is week 6. All right. So the homework grades are turned on. All right. I sent you an announcement about that earlier in the week. Your homework grades are turned on this week and next week. And so if you're seeing an increase in your overall grade, that's great. If you're seeing a decrease in your overall grade, that's not great. All right. It's all homework dependent. Remember, at the end of the term, there's 20% homework, 20 percentage points of homework that will get added into your final grade if your KGA is above 78. You guys all know this. KGAs in this class are 5 quizzes, 3 exams, and a HESI. Okay, so that's why your homework grade looks different this week. And does anybody have any questions about that? At the end of this week, I may wait till next week till we do the exam. If anybody's below a 78 KGA, I do have to do, all instructors have to do what's called a mid-module assessment. You may have heard about these in your other classes if you're below a 78, in which it just kind of outlines where you're at, what you're missing, what you've been late turning in, or what issues there are that are causing you to be below a 78. So if you get a mid-module assessment for me, I don't, like I said, I'm not sure. I might try and wait till next week for exam scores so that everybody has the opportunity to bring their grade up. Okay. So if you receive one from me, just reply. And there's instructions in the message. Okay. Let's go ahead and take the quiz. Okay.
I
The
got a
quiz should
question, Miss Mark, before we start, real quick. So how do we go to after the quiz? How do we go to the breakout rooms?
I take care
Or-
of all that. I take care of all
Oh,
that.
okay.
I put you in
Okay.
breakout rooms just like we did in week 3.
Yeah, I don't, yeah.
Yeah, we did
So
that in week 3. Yep.
I don't
Yep.
remember. But
And
okay.
then room 1 answers question 1, room 2 answers question 2, room 3 answers question 3, and then we come back and talk about it.
Oh, okay.
Okay. So let's go ahead and get started on the quiz because I have it closed at 4:30 and it's a 15-minute time limit. So I want to get going on that. So I'm going to put the access code in the chat. It's my last name, but I'll put it in there. Oops. Make sure everybody's on mute. Please make sure everybody stays on camera. When you're done, don't log off. Okay, don't log off. You can turn your camera off till we come back. We'll come back at 4:30. We'll start. That gives, I think I have a couple of students with accommodations, so they have a couple extra minutes. So we'll get going at 4:30. All righty. Everybody see your quiz and can access it. Fantastic. All right, I'm gonna make sure everybody's muted. I'm gonna mute myself. Hey, everybody done? Let me just double check here. Okay. All right, great. Looks like everybody's done. So if everybody could go back on camera. How'd you do?
I'm proud of myself.
If you're proud of yourself, I'm proud of you as well. Awesome. Rebecca, could you come back on camera, please?
Dad,
And Cecily, you need to come on camera. Hey, Rebecca, you there? Okay. Let's go ahead and review the quiz. Okay, so this week, let me pull up my notes here. This week, we're covering environmental health, occupational health, barriers to learning, and reinforcing health education. There was a little bit of everything on the quiz. All right, so let's do the quiz. Share my screen here. Okay, can everybody see my screen? I can only see a couple of people. Now that I've shared my screen, so if everybody could just stay on camera, that'd be great. Okay, so what do we know? What statement is true regarding children and environmental health hazards? What's our correct answer here?
B.
Why is it B?
Because the kids are smaller.
And
closer to the ground. And they put things in their mouth.
Yeah.
exactly. Exactly. A is incorrect, right? That's an incorrect answer.
Mm.
All
C
of
is
the
it-
other answers are saying they're less likely to get hazards.
Exactly. Yep, and we'll talk about the effects of children on environmental health hazards when we finish the quiz. Okay, number 2. During a home health visit for a pregnant client, the nurse notes the client's husband regularly uses pesticides at work. Another environmental health question. Which nursing intervention is a priority? So what are the
first-
important, what's the important parts of this question? Let's just say this was an exam question. What would you be highlighting? Who's the
Pregnant client.
who's the
Pregnant.
If she's
Yep.
pregnant and he uses pesticides.
exactly. All
And
right.
priority.
So, yep. And Holly, somebody just said the other word. What else, Holly?
Pesticides, pregnant.
Yep. Pregnant, pesticides, and priority. Right? What's the priority? Okay, so what's the correct answer?
Mm.
Okay. Again, another example of a question that maybe more than one answer looks correct. So you had to jump back to the question and see, what did you miss? Did you miss the word priority? All right, first things first, we want A to happen. Okay, but B could also be another answer if it wasn't a priority question. Right? Same as C, same as D. But it was asking for the priority. Okay, we certainly want, if he's working with pesticides and she's pregnant, we want to minimize the exposure. Okay. Question 3, home health nurse works in a community with high rates of complex chronic illnesses and neurological disorders. Which environmental characteristic would be priority? What would you look at?
C.
C as in cat?
Yes.
Yes.
Yep. And we'll talk about this when we talk about more in depth about environmental health. Okay.
I was a little confused about this. I picked D because I thought that would be like a positive thing. And it was
Yeah,
the
I
only
was
one
gonna
that
pick that
was
one at first.
different. I was in between C and D, but I understand why it's C. It's like what the main problem is rather than the solution, you know?
Well, D is actually okay. It's not the
Yeah.
priority, right? I mean, what we're
Yeah.
looking for here is what characteristics, and we can talk about this now, what characteristics of the environment present hazards? So if you think about it,
Yeah.
think about where you live. Okay, think about your own zip code right now.
Hmm.
Are you guys aware of what environmental risks are in your community? So for example, for me, I live right next to a major highway. I live right next to I-70. It goes from the west coast to the east coast. Okay. Around me, there's lots of noise. There's lots of air pollution. Okay. But think about the environment, different environments people live in. Okay. You may live, this says, near a manufacturing plant. You may live near waterways. You may live near a waste site. You may live near a nuclear power plant. You may live near a major transportation hub, airports, maybe train tracks. Okay, every single community that we live in has environmental risks. And we know that the EPA, Environmental Protection Agency, is the federal agency that oversees all of these environmental risks. Okay, you can actually go on the EPA website and plug in your zip code, and it will give you in your community what environmental risks are most common. Let's say you live near rivers or lakes or streams, potential for water contamination. Let's say you live near smokestacks in the rural community or industrial sites that put out pollution. You live near highways, right? Let's say you live near big open fields, the potential of soil being contaminated.
Professor,
Yes.
so also wasn't there's a year in particular that if the house was built before that year, you have the potential for lead poisoning, right?
1978. Yes, Ryan.
Okay, 1978. Okay.
Yeah. Yep, so that's why B's incorrect. Okay, so think about it, and I'd ask you guys the question. What environmental risks are in your community?
We have a
So,
lot of like depots, like the shipping depots in our areas, and a lot of them are centralized around the Susquehanna River, and there's a lot of pollution into the Susquehanna River in our area.
Yep. Excellent example. Anybody else? What are your environmental risks? Has anybody ever seen the movie Erin Brockovich? I always bring this up. Right? Erin Brockovich, the movie about a large PG&E company, gas company out of California, I believe, that contaminated the water, and it ran downstream and ended up going through this very small town in Texas. Contaminated water. All these people in this really small rural town in Texas were getting sick. Cancers, the elderly, pregnancies. And it turned out to be the contaminated water. That's what the whole movie's about. The town fighting back against this big company to help hold them to try and hold them accountable for what happened. Remember Flint, Michigan, several years ago, with all the water contamination. These are all examples of environmental issues, environmental disasters.
would like the area I live in Scranton,
I understand Flint, Michigan is still suffering from it.
Yes, they are. Marquita, yes, they are. Go ahead, Ryan.
the area we live in Scranton was like you know, like I guess about 100 years ago, probably a lot less than that, probably I don't know, but we're like known for our anthracite coal mines.
Yeah, exactly.
So they go all like through, a lot of the mines go through you know, parts of Scranton all throughout, like, you know, the different areas, and a lot of times the ground gives in, it caves in. Would that be considered environmental?
Absolutely. When we think of environmental risks, we think of air, water, soil, Ryan, soil, and food.
Okay.
So that makes total sense. And there's another example of an environmental risk in Ryan's community, coal mining.
Coal mining.
Absolutely. Yeah. All right. We'll keep moving, and then we'll get back to environmental health after the quiz. The nurses so here's an education question. The nurse is reinforcing education about a diabetic client. Which client statement indicates a barrier to learning? Before you answer this, what kind of question is this? Is this a positively framed question or a negatively framed question?
Negative.
So what are you looking for, Holly?
The one that doesn't belong. The one that makes you want to go back and teach them again.
Exactly. And there were several students, there were several negatively framed questions on exam 1, and several students missed those. Okay, so this is a good example. All right. Read the question carefully. What statement indicates a barrier to learning? What does a barrier mean? They're not getting it. Right? They're struggling with it. Right? What are they going to say? What are they going to say that you're going to need to re-educate, reteach, clarify? What do they say?
The keto diet one.
Why, Christian?
Because it sounds negative anyway, like how you read it. It's like we're not talking about diabetic to me. And it's just like you going into a different direction and not being focused on the task at hand, I guess. Like,
yeah, that's one way to look at it. Yep. Yep. Anybody have a different perspective? Your answer's right, Christian.
Hypoglycemia.
Okay.
Go ahead, Cecily.
It causes hypoglycemia for the diet patients, low blood sugar if they're
Right.
on like keto diet.
Right. So you've done all your teaching about diet with this diabetic client, and they say, I'm just going to use the keto diet on this one. They didn't hear you. Or maybe they didn't understand, didn't comprehend, right? So that would be, if the client says that, you need to reteach, like Holly said. Okay. And actually, let me go back. All the other answers are okay,
Yeah.
right? English is my primary language. That's not a barrier. I'm familiar with medical technology. Great. That's not a barrier. I'm ready to learn the things I need to change. Those are all good answers, right? So that's another cue. If you have a cue, if you start reading the answers and go, wait, these answers sound right. What am I missing in the question? Oh, they asked me what is a barrier. What's wrong?
That's just like the other one too. It's like a process of elimination. All the ones was
Exactly.
like negative, and then there was the one answer that was positive.
Exactly. Exactly. All right. Which nursing intervention will enhance the learning for a client who speaks English as a second language? What will enhance the learning?
Getting a pamphlet that they can read in their own language.
In their own language. If they have a language barrier, right? Why would you provide a recording of your teaching for them to view later? They're still not going to understand it,
Yeah.
right? Include the family in a teach back session. Okay, maybe. However, if English is their second language, how do you know that the family's second language is not English as well? How do you assess the family? I mean, interpreters are always the first line of defense, right? If you can find an interpreter, if you're in an organization that has interpreter services, or you can, maybe some companies contract with interpreter services. Interpreters are always the first best case scenario. However, sometimes you do have to rely on the family. But what if that family shakes their head like they understand, but what if they don't? Right? So you have to be careful with family members. Yes, they can be extremely helpful, but you also have to assess their language barrier if there is one. Right? And then why would we give a client a dictionary to learn the vocabulary? That's silly. That's a silly answer. All right. So the goal here is, and we'll get into this more when we talk about reinforcing health education. That's why, when you call places, they may say for English, press 1, for Spanish, press 2, for Vietnamese, press 3, for Russian, press 4. Okay. We did this in the schools. We had a handout for lice or a handout for scabies. We had it in several different languages. Clients always learn best in their primary language. That in the community, that could mean maybe radio ads in their primary language, TV ads in their primary language. Everything you need to try and accommodate as much as you can in that primary language. Okay, home health nurses reinforcing education on the use of a glucometer. Which approach would be most effective?
A.
Most.
The one when she demonstrates.
Demonstrate using the.
Yeah. What's that called?
Teach back.
Teach back. It's always the best way to learn, right?
Yes.
This is the way I worked with all the kids in the schools that were new diabetics or the younger kids that wanted to transition into doing their own glucometer or insulin shots. Right? You teach them, you demonstrate to them, and you make them show you how to do it. Right? Providing a pamphlet, okay. That's okay. Right?
No, you put that.
Yeah, but sometimes they cannot read properly.
What?
Sometimes they cannot read properly.
Right?
They don't
Refer the
understand.
client to a support group. Okay, that's not wrong. Create a video of the nurse describing the glucometer. Okay, that's not wrong either. Okay, but what's the priority? Teach back method first. All those others can be supportive, right? After the teach back, right?
Right, but they wanted the most effective way, and the teach back is the first
That's
most
what I took it.
priority.
Exactly. It's asking what would be most effective. Teach back. The others, they could work, but they're not the most effective, right? So again, a lot of key words in here in these questions. The home health nurse is reinforcing education with an 8-year-old client with type 1 diabetes. Okay, which approach will be most effective?
A.
Yep.
A
The
choice.
demonstration.
Right. Teaching them. I used to have little pillows, little teeny big thick pillows that the drug companies used to give us with practice needles. Right? Or at that age, maybe they want to practice on their favorite toy or doll. Okay, obviously somebody 8 years old can't do B, right? We
No.
teach the parents rather than the child. No, if the child's expressing interest, let's work with the child. At 8, they're capable. Okay, teach through written pamphlets. That's not age appropriate for this group. Okay, number 8, which nursing intervention is a priority for a client who's not motivated to learn? And we'll talk about this. Motivation or lack of is one of the biggest barriers. Low literacy, language barriers is big, but motivation is not far behind it.
See,
Okay,
this
you
is
got,
what, oh, sorry.
I got that wrong.
go
Yeah,
ahead.
me too, because when I was reading, this is what kind of, and then I'm pretty sure I'm going to understand it once you say it, but like my understanding of it from when I was reading, it was like you had like, you kind of gotta, like if they're distracted or they unmotivated or something, like you want to get to, like basically I picked, I think C,
I
because
picked
you
C
want,
too.
yeah, like you
Pick
want
B.
to, you
Okay.
gotta, I understand the trust and rapport because you want to get them, you know, the patient, you want to build that trust so they can feel like, okay, I'm comfortable talking to you, I'll listen. But at the same time, it's just like, to me, that would have been like the second thing I would have did, like, because you got to learn them. And then, I don't know, like for
Nope.
my
Yeah, because I look for the word motivated.
Yeah. Okay.
yeah,
So,
like
but wait, what's the important word in this question?
motivating or priority.
Intervention.
Well,
Priority.
Mhm.
What do you have to do first?
You got to build trust.
Christian,
Yeah.
Christian, you're not wrong. You're not
Yeah, but
wrong.
I'm with her too because I picked C. I was in between those two,
Yeah.
Yeah,
But
but
me
what
too.
needs to
yeah,
happen first? You have to
Build
establish
trust.
your credibility,
yeah,
Yeah.
right? As a
Listen.
teacher, I have to establish my credibility with you, my students. You have to feel comfortable that I have the experience. I know the content, right? That has to happen first. Then the other ones are okay. Well, I'm not sure that you would call somebody out and say, why are you unwilling to learn or change? Probably not going to provide a list of consequences. If you don't learn, you are going to be in trouble. No, we wouldn't do that. But B comes right after D, or C comes right after D, right? Because first you have to establish trust, credibility, and rapport, right? There, you are going to have people in your groups that are not motivated. Okay. And then once you establish that trust and rapport, C is what we call reading the room, right? Right?
yeah.
Who are there some people that have, let's say have you guys ever been in some kind of a continuing education class that you're going, oh, again, I have to do it every single year. And you're just not there, right? It's just this mandatory training that you have to do every year and you've heard it before, and right? I mean, we've all been there, but you have to be able to read your room. I did this. I had to do this with students in the schools. You know, go from at the beginning of the day teaching a bunch of preschoolers how to wash their hands the right way. Bunch of 3 and 4-year-olds. You know, they think it's great. They're motivated because they get to play in water and pump soap dispensers, right? That's fun, right? You get up to the elementary school, middle school, talking about helmet safety, you know, middle school talking about whatever topics you want to talk about. High school, then you start talking about substance abuse and risks of suicidal ideations, right? I mean, you have to know your room. You have to know age, culture, right? Motivation. Lots of things play into how much people want to learn, how much they're motivated. What if you have people that are hearing impaired? Think of the elderly. You're teaching the elderly. Maybe some are hearing impaired, some are visually impaired. How do you tailor your teaching to all the groups that different groups that potentially have barriers? Does that help,
Yeah.
Christian?
Somewhat.
Yeah,
I'm
still, but I just don't agree.
see me
I'm
too.
sorry?
I'm glad somebody else felt where I was coming from.
Well, okay. Do you understand why
I
D?
get it. Yeah.
You,
Yeah.
I
D
get
is,
it, but it's still like confusing.
It is confusing. And like I said, much of when I read what I read, it's just like you said, I'm not wrong, but it's just like I missed
Mhm.
that priority word in the trust.
Yeah.
See,
Me too.
yeah, yeah. So the priority is to establish trust and rapport. After that, yes, one of the things you would do would be to assess the preferred learning style. Okay,
Yeah, that's annoying. Oh.
sorry. Sorry. All right. Occupational health nurse is caring for a client who reports lower back pain that's worse at the end of the workday. What's your intervention is a priority? Well, first of
With the
all,
technique.
hang on. Let's talk about occupational nursing. What's an occupational nurse?
That's like the
What is she responsible for?
like
Safe
a work
body.
environment.
Work environment. Okay, so we'll talk more about that in a minute, but the occupational, somebody's having lower back pain that's worse at the end of the day. So what's she gonna look at first is a priority.
Right. She's gonna look at their like how they're working, like the working environment,
Yes.
how she's like the
How
body
they perform.
the body
Yeah.
technique, like how she's picking, lifting, moving,
Yeah.
like if she's using her. And
Yeah,
I only know that too because I worked in a factory and warehouses too.
Well, then that's exactly right. So first things first, her priority is gonna, if in this job description of this particular worker, there's a lot of lifting. Now they're complaining about back pain. First, foremost, we're going to assess how they're lifting. How are they
Right.
doing it the right way or the wrong way? Okay, first, that's what we're going to do first. And we certainly wouldn't do A. We're not going to be doing C. And we're not in a position to do D because we're not diagnosing.
Yeah.
They're not
Right?
doctors.
Right. So that's what an occupational nurse does, assesses the work environment for safety risks or whatever other risks. We'll talk about that in a second. All right, last question. Which statement is true regarding the schedule of client education? Do we do it on our time or their time?
No. Their time.
Their time.
Their time.
And their comfortable time.
Right? And that also contributes to learning, right? Working
Yes.
around their schedule. Right? Have you ever, I've been there. Have you ever been getting ready to be discharged from the ER, the urgent care, or the hospital, and the nurse runs in and says, okay, here's your discharge questions, or here's your instructions real quick. Let's go through them real quick. I'm really busy. I have 20 other patients, and this is the only time I can do it, and I have 5 minutes, and we need to get done right now. And then I say, well, my husband's not here, but he'll be here in like 10 minutes. Could we just wait and do it when he's here so he can hear? No. I don't have time. Have you ever been in that situation?
Yeah.
Yeah. Yeah, I have too. It's frustrating. All I wanted was my husband there to just be a second ear. I was still all drugged up on medication for my back surgery a couple of years ago. Right? I'm still kind of confused and a little bit just kind of out of it. I just wanted somebody else to hear. Right? But that wasn't a possibility. That wasn't an option. So it really should be when the client is most comfortable. The right answer would have been, of course, we'll wait for your husband to get here. I'm going to go do some other tasks with my patients, and I'll be back in a half an hour, and we'll do it with the both of you together.
This one was a little tricky too because it's like I was going back and forth what I know, like the comfortable And then like arrangement of family not in a way, because again, it's like when I was reading, it said that you can't really focus if you have distractions. And then, but I was like, okay, but you got to do it when they're comfortable, because if they're in pain, then they probably won't listen or understand it or
Exactly.
comprehend it. But then it's just like, well, they can get paid. Like, what if they do it when the payment is like? So this one was a
You
little,
are Christian, you are overthinking.
yeah.
You are adding so much into these
No, I only did it
questions.
that one time, but it just shows that I was reading like I was trying to comprehend everything that what I had got from the reading though.
Yeah. Well, teaching is most effective when the client is most comfortable.
Mm,
Okay.
I suppose.
Christian, you're funny. Okay, so in the big picture, here's what we're covering. We've just covered quite a bit of it, actually. So let's start with occupational health. If I look to my right or left, whichever it is, I'm looking at my notes. Okay, so occupational health, it's about the workplace. The occupational health nurse plays an extremely important role in the healthcare team. Whether you're in a big organization and have a occupational health department, whether you are in maybe a smaller organization that has an occupational health nurse, whether you're in a school district that has a health and wellness department that includes occupational health, whether you work in a McDonald's and if there's an occupational work issue, there's always somebody contracted. Okay. What we know is that the nurse does workplace assessments. He or she needs to know about what people do. Everybody has a job description, right? Think of a big hospital. You've got transport department, radiology, transport department that lifts, radiology, let's say OR that's around chemicals, nurses that have all kinds of risks in their job, CNAs, food service, environmental health services, and on we go. Okay, that occupational nurse or department is responsible for ensuring a safe workplace. People are following the protocols. Okay, there are occupational safety standards in place in every organization, whether it's a fast food restaurant, whether it's a sit-down restaurant, whether it's a hospital, long-term care, assisted living, doesn't matter. Every workplace has occupational standards, right? And those are put in place by OSHA, right? We've all heard about OSHA, Occupational Safety and Health Administration. Okay, occupational safety standards are in place for everybody. OSHA enforces them. So let's say you work in a hospital and there's been an unexplained death in the OR, or you have an increase in patient falls. OSHA, or there's an accident, chemical spill, some kind of disaster, whether it be in the schools, in the hospital, OSHA is going to come in and look at, did you follow the safety guidelines? So that nurse or that department, that team is responsible about knowing about job descriptions, knowing the risks in job descriptions, what the occupational risks are, and providing that teaching and education to make sure everybody can perform their job safely. Because the goal is to have everybody at work 100% of the time with the competence, right? Then we know potential hazards. There's hazards in every single job. There is no safe job. Okay, even if you work at a restaurant, you have risks for burns or fires. You work in a hospital or you're lifting people, you have risks for musculoskeletal strains or disc, whatever. Every work environment has risks. All right, that occupational nurse needs to understand the work practices of employees. Let's say you work in a factory. Well, Kristen just said it. She works in a factory and she did a lot of heavy lifting. So I'm assuming that part of your training before starting that job was how to lift the correct way. Right? So part of occupational nursing is we are going to have people that get injured on the job, or they get injured off the job and they can't come back to work. All right. So So we're going to see various injuries and diseases acquired from employment. Let's say you work in Christian's industrial plant and it's super loud. Do people have protectors? Do they have personal protective equipment for their ears? Let's say you work around chemicals. Do you have eye equipment? Let's say you work in the operating room. Do you have personal protective equipment to protect you? Okay, we know that we are going to see various injuries and diseases. Okay, people get diagnosed. We spend what, a third of our work? It's estimated we spend a third of our time at work. Okay, so things are going to happen. Accidents, injuries, new diagnoses coming in. Maybe people, in the schools, kids coming in with new diagnosis of diabetes, people coming in with mental health illnesses. Okay. So that's also part of the occupational nurse. He or she functions a lot like a case manager, where they're coordinating care. Let's say somebody's been injured on the job with a back injury. Well, that occupational nurse is going to be talking to HR about leave. They're going to be talking to the doctor about restrictions. They're going to be talking to, maybe following up with PT. Are they ready to come back to work? Can they come back full duty? Can they come back limited duty? Right? Think about all workplace violence. Think about all the people. Think about everybody bringing everything to work, whether it's physical limitations, mental health diagnoses, substance abuse, alcoholism. I mean, think about it. You all know people in your workplace. Everybody has issues, right? And everybody brings them to work for the most part. Some can manage it, some cannot. Right? And then you add on top of that injuries, add on top of that unforeseen chemical spill, a outbreak of COVID, an outbreak of something in your facility. Okay? Occupational nurses, they also do primary things, right? So we're educators. I know our health and wellness / occupational health did a lot of seminars on healthy diet, balancing work and home, healthy living, right? So there's a lot of opportunity to do health teaching, health promotion. We talked about case managers, counseling, crisis intervention. Let's say you've got a lot of mental health issues, or you have somebody's going through a divorce, or somebody who has problems with their kids, right? A lot of times they provide resources, but a lot of big places have what it's called something different in different places, but it's an EAP, employee assistance program, for people that are struggling, right? So they may be involved in that. Health promotion, risk reduction, legal or regulatory compliance. That's where OSHA comes in, right? And they're always looking at worker risks, workplace hazards, for equipment, for any kind of risk for injury. Okay, so that's what an occupational health nurse does. Here's some examples of primary, secondary, and tertiary with occupational health. Maybe the occupational nurse is teaching coping mechanisms proactively, providing health education, educating on the proper lifting, bending techniques to prevent something. Secondary, screening for something, screening for hearing loss in those noisy plants, maybe blood pressure checks, right? Maybe a health fair for your organization, screening for stress and burnout. How do we screen for those high-risk people that are under so much stress that accidents can happen when you're not 100% focused, right? Whether it's due to stress, burnout, life changes, life-altering event. And then tertiary, something's already happened. There's been an illness, there's been an injury, there's been a new diagnosis, there's been an accident, right? So the occupational nurse will look at, can they come back full-time? Can they come back limited duty? Whatever their restrictions are, can they still go into their job, their old job, or do we have to do some kind of a modified job for them? All right, let's say somebody's had back surgery. I can tell you when I had back surgery, they made sure I was wearing my back brace. Right? Because then I'm at risk for injury again. Right? Maybe somebody who had carpal tunnel. Are they wearing their little wrist braces? Got to follow up on that stuff. Questions about occupational health? Does that help? Okay, environmental health. We started talking about it. Do you know that environmental hazards are responsible for 1/2 of the disease in the country? They contribute to over 80% of communicable and non-communicable diseases. Children much more vulnerable to environmental hazards. We talked about this. Okay. Environmental health determined by a few things: genetics, socioeconomic status, environmental issues. Okay. We talked about, we talked about our own zip code. Think about our own living area. Think of all the examples of pesticides and things you have lying around your house, in your garage, whatever. Gardening things, cleaning material. You know, you don't really think about that. But think about all the environmental risks we have in our home, that are in our community. Think about people living in poverty, all the additional environmental risks that poses to them. Maybe there's a genetic predisposition. Maybe there's a history of autism, history of developmental delays in your family. That's the genetic part. The socioeconomic status is living in poverty. Environmental risks are also behavior related. Right? You choose to live whatever kind of lifestyle you live. You choose to be unhealthy. Right? You choose to be overweight. You choose to abuse substances or drugs. Those are the environmental risks that are behavioral, that are your choices. Okay. People living in poverty, more likely to be exposed to environmental hazards due to crowded living conditions. Maybe they're living closer to hazardous waste sites, having poor quality foods available, having more hazardous jobs, right? More high-risk jobs, living in older homes with lead-based paint. Maybe their kids go to school or daycare and communities that have much older buildings. Okay. So when we're doing an environmental risk with our families or individual, where do they live? Where do they work? Where do they go to school? What's their diet? Think about water. Let's say people live near waterways and they do a lot of fishing and they eat a lot of seafood or fish. What's that risk? What's in the fish?
Mercury, isn't it?
Mercury. I mean, you don't really think about that, do you?
You do
No.
for pregnant women because they teach you teach you to
Absolutely.
tell pregnant women not to have a lot of fish or seafood in their diet due to mercury and
Yeah.
heavy iodine.
Yeah. Pesticides, chemicals in our homes, in our schools. Think about all the stuff in the schools, the chemicals in the schools and the daycares and the workplaces. What if you're in an agricultural rural community? All the pesticides and chemicals around the farms. It's estimated that 30 million Americans drink water that doesn't even meet the EPA safe water drinking standards. And it's estimated 50% of Americans live in areas that don't meet the national air quality standards. The one thing we didn't touch on is food. Food as an environmental risk. I don't know about you, but when I go to a drive-through, fast food, or go to a restaurant, I just make the assumption that everybody's doing what they're supposed to be doing. Right? The food is stored correctly, the food is prepared correctly. The employees are practicing good universal precautions. I make that assumption. But that's not the case all the time. And that's when we have food outbreaks, food salmonella, right? So food, air, water, food, and soil. Think about soil and potentially contaminated soil. Let's say they're building a new residential area on maybe an old hazardous waste site. That all has to be looked into. There's just so much to think about with environmental hazards. So much. What else about environmental health? I think we covered. Yep, we covered that. Okay, barriers to client learning. Oh, environmental health risks. Okay, we probably already went through this. Where do people live? What's their dietary history? Lead-based paint, pesticides, drinking water, air quality. We went through all of that. Okay, environmental health in children. Kids are more sensitive, much higher risk for childhood cancers if they have lots of environmental risks. I think about that movie, Erin Brockovich, and all those childhood cancers that started coming up with all these kids. They do have an underdeveloped liver. They don't have 100% functioning immune system. Breathe faster, consume more food, water by body weight. These are all issues that affect, they're more vulnerable, right? Kids are more vulnerable to risk factors. Talked about food. Food contaminants and food handling, salmonella, E. coli. You know, what if people in the food industry or places are cleaning everything with their pesticides, chemicals, and they don't wash their hands? Think about it happens. Kristen, you're shaking your head. Stuff like that happens.
No,
Right?
I'm shaking my head because it's nasty.
It is nasty, but we become so accustomed just assuming everybody's doing their job and doing what they're supposed to be doing. And that's not always the case. Right? Barriers to learning. Let's jump there. We've talked a lot about this already. Patient education is one of our most important roles as nurses. We do it everywhere. We do it at the grocery store. We do it at family cookouts. Everybody runs to the nurse, right? You're supposed to be the expert on everything, right? So we're educating outside the workplace, within our families, family gatherings, but we're always educating. We use education for numerous reasons: promoting health, preventing illness, injury, improving behaviors, right? Helping people care for their own conditions. We're always doing patient education. And that's just a lifelong learning. Lifelong learning and education. That's what we do. It doesn't matter what area of nursing you work in. If you have contact in the area of nursing, if you have contact with clients, you're going to be doing education. Right? We know education empowers. Right? The more educated we are, the better we are in a position to make healthy decisions and healthy choices. Right? One of the biggest barriers, low literacy. What are you going to do if the patient doesn't speak primary language? It doesn't speak English. You're going to try and provide as much teaching and education and counseling and training and teach in their primary language. Culture, we have to keep in mind culture. Yes, as we're teaching different cultures about whatever, we have to keep in mind their values, beliefs, and their practices and try and incorporate as much of their culture into the teaching. I know I've mentioned this before. Right? Another barrier to learning that came up the other day is immigration. Right? People are afraid to come forward, maybe because they might be questioned about their immigration, so they're not going to show up for a well child visit or show up for an immunization visit. Right? Lack of confidence is another barrier. All right. I really can't, I don't think I could teach myself to give a shot. Right? Motivation is another one. Self-confidence, motivation. We have to understand how people learn. And there's 3 ways, which I'll talk about in a second. Okay, here it is. Different ways to learn. All right, we're always teaching, so we have to keep this in perspective. We have visual learners, we have auditory learners, we have kinesthetic learners. That's the hands-on. And we all have 3 different domains of learning. We all have cognitive thinking, affective thinking, and psychomotor thinking. Okay, one usually is dominant. For me, I'm a psychomotor learner. I like hands-on. If I have a problem with my television and I can't figure out how to turn it on and off, half the time I can't figure out anything. Call one of my kids. Oh, mom, just do this. It's like, no, you gotta show me. Come and sit with me and show me on my clicker. I can't take directions like that. But some of you may be cognitive learners. Cognitive is thinking. Okay, the ability to hear the information, understand it, memorize it, and use it to solve problems. The thinking part of it. Affective is the feeling. Okay, what are your attitudes? What's your attitudes towards what's being taught to you? Not you, but whoever you're teaching. What are their attitudes? What are their feelings? What are their beliefs? What are their values? You know, maybe you're sitting in a seminar that you don't agree with the topic, or you don't agree of how it's being presented, right? Are you really going to get everything out of that experience? Probably not. That's the thinking part, your attitude towards, it's the example I gave at the beginning. Oh boy, we got to go to this annual training again. So stupid. We do it every year. I don't get anything out of it. That's your affective kicking in. Your attitude and feelings towards what's being taught. You're probably gonna, I don't know, blow it off, be distracted. Then the psychomotor is the moving part, the teaching, right? You're learning through practice, experience, hands-on, right? That's the glucometer, showing somebody how to use a glucometer by you demonstrating the teach back method and them demonstrating back to you. Okay, we do have to be prepared to address all these kinds of learners, cognitive, affective, psychomotor learners, right? And you're going to have one of each of these in every one of your groups that you teach. Okay. This is a good statement. I kind of just said this. If education doesn't address all 3 domains, you're not going to be nearly as effective. Telling somebody to change without motivating them to do so, or providing them with the skills necessary, it's not going to be effective. I mean,
that go into what you were saying, like the trust and rapport thing?
Yeah, that's exactly right. I want to trust, if I'm being taught, take my discharge from back surgery, that example I showed you. By the time she came back, the nurse, she wasn't patient with me. She didn't want to wait for my husband. She was chippy. She was busy. She was already having a bad day. And it all came through when she was teaching, right? It all came through. And I was more focused on, ew, this is not right, versus listening specifically to my restrictions. I wasn't focused on my restrictions. I was focused on her being kind of a knucklehead, actually. Right? She didn't do me any favors by doing it the way she did it. That's exactly what that is, Christian. Right? I was mad. I was in so much pain. I was mad. Okay, reinforcing health education, collaboration with patient and staff to develop a plan. Again, You have to know your audience, right? You have to develop whatever the needs of your audience are. There may be multiple needs. We already talked about that. People that lack self-confidence, people that lack the primary language, people that have auditory or visual issues, people at different ages. Okay. Let's say you're working with an individual or a family, right? What's the plan? You know, how best can we have to go through our discharge instructions. How best can we go through that so that you gain the knowledge that you need? Would you like a family member here? Right? How would you best like to receive this information? Right? Is there a knowledge deficit? Is there low literacy? One of the biggest problems with teaching is low literacy. And I don't say that as condescending. Low literacy simply means that you're not understanding what's being told to you, whether you have a lower education level, whether you have a language issue. Low literacy is a big one. Okay? When do we start discharge planning?
At
When they
admission,
admit it,
Why?
because they say it's an easier way to remember what they are being told. They'll
Yeah.
remember.
Yeah. Okay. Learning has not occurred until behavior has changed. You can listen and listen and listen and listen all you want. But until your behavior changes, learning truly hasn't occurred. We know that behavior changes are hard. Does anybody work with somebody who says, I know they have a new way of giving report. We're going to do it at the bedside now. Shift change versus sitting in the conference room going through report. Right? We're going to do it at the bedside now. It's more effective. And anybody work with somebody that would go, no, I don't really want to do it that way. I'm fine with conference room. Anybody work with people that way? People like that? Change is hard. Okay? We tend to do the path of least resistance. Right? Two people entered the waiting room. Who's that? Oh, that might be people for my review. Okay. All right. Here's what I'm going to do. I know we only have 4 minutes. I was kind of probably talking more than I should have. I'm going to send you versus breaking out into breakout rooms because then we're going to get way over. I'm going to send you the case. You have the case study. I would like for you to take the next couple of minutes to read through that case study I sent you. Okay, it's actually a really good case study about teaching. Okay, and then when I send you the recording of this, I'm going to send you my notes from the case study. It has the answer and it has the rationale. Okay, so for the next couple of minutes, well, actually, why don't you all pull the case study up versus going into a breakout room? Pull the case study up. Okay, so this is the school nurse providing education to students, parents, faculty with the intent of providing individual groups with tools to make informed decisions. Vinaya, that's fine. Just make sure you watch the recording. Health education in the school is aimed at promoting healthy habits, lifestyles, preventing illnesses, teaching measures to identify problems at an early age. An important factor in the process is for nurses to set examples, right? This is talking about in terms of weight management, physical activity, lifestyle choices. So now you have a school nurse, Robert Miller. He's working in an elementary setting, right? One of the first steps in creating an effective educational program for the students is what? What's the right answer? Should be right in front of you. What do you have to do first and foremost when you're creating an educational program?
Would it be C?
C. You have to identify the learning needs of the population. You can't put together an education program if you don't know what you're going to be teaching. Right? You got to think of AdPi. You have to do an assessment. What do they need? Right? So first you need your learning needs. Right? And you have this case study, but I am going to send you the one with the answers and the rationale. Number 2, he's creating a program for second graders at his school. His topic is related to exercise and fitness. What would be an appropriate educational objective? What's an objective? Objectives are short-term, right? Objectives are short-term and specific. They are made, they're steps toward achieving long-term goals, right? Remember that about objectives, right? Objectives are written statements of an intended outcome or expected change of behavior that defines how much knowledge you have. So if we're looking at this, right?
Would that be C?
C, because it has a measurement, right? Within 2 weeks, each of the kids will be able to demonstrate at least 2 exercises they've learned. Objectives, short-term goals for an expected outcome. Does that make sense? And then lastly, I love this question. He's a school nurse educating the children about health promotion. However, he's obese and he keeps going out to take smoke breaks. So this question's about, this is an educator-related barrier, right? Which of the following might be an educated-related barrier? What did we talk about at the beginning?
Maybe A.
With that question, Christian, lack of credibility. Right? And lack of credibility is it's common. Okay? We can increase our confidence by preparing the talk, researching it, being confident in the way we deliver. Right? Okay. So before anybody jumps off, do you have a better understanding of environmental nursing, occupational nursing, education, barriers? Okay. For those of you that missed quiz question, did it help to go through it? Do you have a better understanding of that content? Okay. Fantabulous. Okay. So before anybody jumps off, it's Friday. I'm only 1 minute late today. That's good. I hope everybody has a good weekend. And I'm going to leave you with this thought. If you get into the middle of next week and you're struggling with any concepts from weeks 4, 5, and 6, I need you to reach out to me and schedule a Zoom session, a quick tutoring session to review anything you want to go over. So I'm offering that up to anybody. Okay?
Professor, you said that you I'm sorry, I didn't mean to interrupt. You said that you had another exam review on Sunday?
There's one Sunday night, yeah. Not me, Professor Kershaw. Professor Kershaw. Mine's in a half an hour.
Okay, thank you.
Okay,
Thank you.
so I hope everybody has a fantastic weekend. I hope this was a productive use of your time today to learn about different aspects, again, of community nursing. Hope to see you guys at a review in a half an hour. If not, please watch my recording at some point between now and next Friday. Please. All right? Have a good one.
Thank you.
You're
Thank you. Bye.
welcome.
Wait, Miss Marvel, I got a question.